Hello, everyone. My name is Jamie Russell. I work for the Interpreter Services Department, and I'm going to talk to you today about language access at UNC Health, specifically for the Emergency Department at the Medical Center. A little bit of background about why I'm talking to you today about this. There are different laws, Joint Commission standards, and internal UNC Health policy that require language access to be provided to limited English proficient patients, and this includes patients who need ASL. This can take on different forms, which I'm going to go over with you today. A couple of reminders. Please, please, please only work with qualified interpreters. Family members should not be interpreting, and children should never be interpreting. Remember, interpreters are not only the voice of the patient, they're also the voice of the provider, and the providers are the ones burdened with ensuring effective communication. Qualified interpreters help ensure that the message is not distorted in any way. When we talk about language access here at the medical center, especially in the emergency department, we have different options. We have Spanish staff interpreters who are here 24/7. We have access via the phone, any landline you can grab, you can dial the number. It is *468. We have video iPads, many of them that are placed around the hospital. You will use these specifically for ASL because of the video component. And then we have Spanish translations of written content. I'll go into that a little bit later. And we have bilingual staff who have been cleared for this. So for in-person, that is Spanish again, we are available 24/7. You will go to the intranet and you can go to our department and you will reach Service Hub. That's the platform we use, and you'll create a request. Somebody from our team will pick it up and then go walk over and help you with your language needs. The phone, *468. You can dial that from any hospital landline phone. It can actually also be transferred over to your Vocera, which is very convenient. Or there's a local number, a 984 number you can find on your badge buddy. You do not need to create a Service Hub ticket for these. The video iPads in the ED, there are several video iPads. Some of them are black, some of them are orange. There might be a green one. They all serve the same purpose. You might have to go find them. Okay, so please ask your coworkers. This is important if you need visuals, and it will be absolutely necessary if you need American Sign Language access. You just turn on the machine and then follow the screen prompts to connect to the service. Again, you do not need to create a Service Hub ticket for this. Just grab it. We have Spanish translations of written content of a bunch of things. You can find them on our intranet. A lot of these are consent forms, refusal of blood products, etc. We also have a lot of smart phrases already translated into Spanish. You might have to ask your department head or colleagues if you have specifics for your department. And then you can go into HealthWise and attach any general information to a patient's paperwork. They have a lot in Spanish, but they do also have quite a few things in other languages. I think French is next after Spanish. However you provide language services, please, please, please always document the interpreting encounter in Epic. Everybody's going to be super happy and in compliance. Now let's talk a little bit about bilingual staff. If you are a bilingual staff person and would like to use your language skills during work, we have to have proof of language proficiency. Just because you say you can do something in another language doesn't mean that we should trust you at your word. So there's a test to be taken, okay? Currently, there are over 350 people cleared for different roles here for language proficiency. Most of those people are cleared for Spanish, but we do have a bunch of other languages that we can clear people for. We work with an external vendor for these. Just because you are cleared as a bilingual staff person does not mean you are cleared to interpret, okay, for others. These are different hats that you have to wear. And if you're a nurse, you need to be doing nursing duties. If you are a physician, you need to be doing physician duties. You don't need to mix these roles up. And Joint Commission standards and the laws specifically separate these roles out. This is not just us. A question that we get a lot is, I grew up speaking another language. Why do I need an assessment? Again, this goes back to taking people at their word. Language proficiency skills are very commonly overestimated. People think that they're stronger than they actually are. That's why you need a third party to say, yes, you have the language skills that you claim to have. And remember, bilingual providers are simply providing care in another language, so this falls under the same scope of your practice and license. Everybody is tested on a bunch of different things, and language proficiency is no different. If you are interested in a language assessment, here's a little bit more information about that. We work with a vendor, Alta Language Services. It's very convenient to take. It's on demand. You can do it over the phone or through the PC with the headset. It takes no more than 45 minutes, and there's different tests for different professions, so please spread the word. They have a whole bunch of different languages. If you are interested in this, please reach out to me. You can find our contact details or my contact details on our intranet page, Interpreter Services. Okay, let's talk a little bit about misunderstandings that might happen when unqualified people are interpreting the communication. In Spanish, we have on the left a phrase that says no lo siento, and then no lo siento. These have two very different meanings. The first meaning is I don't feel it, which could be a patient saying he doesn't feel when the doctor's pushing on his foot, or it could be the doctor talking to the patient saying, no, I don't feel the bump that you're referring to. And then no, comma, I'm sorry. Okay, so the power of punctuation is very visible here. And then we have the case of Willie Ramirez. This is very famous. You can just Google it. Willie Ramirez interpreting miscommunication. He was actually left quadriplegic after a miscommunication or a series of miscommunications with the family and was awarded $71 million. And this all has to do with one word in Spanish, intoxicado, does not mean intoxicated in English. That is a false friend or a false cognate, and this is what unqualified interpreters run into a lot. They think it means one thing, but it actually doesn't. Intoxicado in Spanish, for the most part, means food poisoning. So the family thought that he had some sort of case of food poisoning, but the doctors interpreted that he was either drunk or high on something, so he did not get the care that he needed in a timely manner. Please, please, please do not use Google Translate for a variety of different reasons. The most technical reason is it's not approved for translation, okay? And a bad translation can actually make things worse than no translation at all. You know what they say, the road to hell is paved with good intentions, okay? So I know everybody's trying to help. Everyone who works here at the hospital is a helper. That's what we do. It's part of who we are. Sometimes a bad translation can make things worse. Again, related to Google Translate, the latest update on this was very recently, last month, update to section 1557, clearly stating a machine or automated translation is allowed only after being reviewed by a qualified translator. You cannot just pump something in and then copy and paste the output. That is a no-go. And here are some examples of things that we have found in UNC AVSs put in there by well-meaning, well-intentioned providers using Google Translate. These are mistranslations. So you see some of the examples there. The funny one is in the middle is return to erectile dysfunction if things worsen. And this was for a 6-year-old female. You can imagine the family of the patient kind of raising their eyebrows there. Okay. And then these are some things that are found in Google Translate. Again, mistranslations. They seem a little bit funny, but you just never know how people are going to interpret things, and you just want to be safe. If you want some light reading after this presentation, here are some of the laws in the Joint Commission standards and different policies and regulations that you can look into to read up on why it is that we're providing language access, what's involved, what we're required to provide, what we're not required to provide, etc. And if you have any questions, you can feel free to reach out to me. My name is Jamie Russell, and here's my contact details. Thank you.